Do you know that India is the diabetic capital of the world? As per the Indian Council of Medical Research, India Diabetes Study published in 2023, the prevalence of diabetes is 10.1 crores. 1 in 11 people in the world is affected by diabetes. 1 in 2 people doesn't even know if they have diabetes. Welcome to Norgami Vision. My name is Parvati. I am a researcher and I have type 2 diabetes. What is diabetes? Diabetes is known as high levels of blood glucose in the body, commonly referred to as blood sugar. What all types of diabetes have in common is that they cause people to have too much glucose in their blood. There is no cure for diabetes, but we can control diabetes by changing our lifestyle and diet. High levels of sugar in the blood can cause serious, sometimes life-threatening health problems, like blood vessel damage, blindness, heart disease, and kidney failure. There are 2 types of diabetic conditions, type 1 diabetes and type 2 diabetes. 90% of adults over the age of 40 are most affected by type 2 diabetes. Only 10% of people, mostly children and young adults, are affected by type 1 diabetes. To understand diabetes, it is important to know what is glucose and insulin. First, we try to understand glucose. Glucose is another name for sugar. Everything we eat or drink that has carbohydrates breaks down into glucose during the food digestion process, which is carried by the bloodstream to various organs of the body, muscles, brain, heart, and liver, where it is either consumed as an energy source in muscles or is stored for later use in the liver. Glucose is very important in our body because glucose is a source of energy for humans. All types of diabetics have one thing in common: these people have excess glucose in their blood. How does insulin work? When you hear the word insulin, you may think of a drug taken by people who have diabetes. Insulin helps move sugar from your blood to your cells. Our bodies need insulin to use or store glucose for energy. Without insulin, glucose cannot enter the blood cells. Insulin is very important for the body. Insulin is made in the pancreas, a gland located behind the stomach. Insulin is like a key that unlocks these cells so that glucose can enter into these cells. In healthy people, when new glucose is formed, the body sends a message to the pancreas to produce insulin. The pancreas starts making keys quickly. With the key, the door opens, and the blood cells begin to receive glucose. And the energy flows continuously in our body. When insulin is deficient, muscle or liver cells are unable to use or store glucose, and as a result, glucose accumulates in the blood. In type 1 diabetes, beta cells of the pancreas are destroyed by the immune system by mistake. The reason why this happens is unclear, but genetic factors are believed to play a major role. Insulin production is reduced, less insulin binds to its receptor on target cells, less glucose is taken into the cells, and more glucose stays in the blood. Type 1 begins to affect at an early age, and symptoms commonly start suddenly and before the age of 20. Type 1 diabetes is normally managed with insulin injection or a pump. Type 1 diabetics are, therefore, insulin dependent. Type 2 diabetes usually begins with insulin resistance. This is when the cells can't use insulin properly. Cell walls have little locks called receptors. Insulin fits into those locks like a key. When insulin opens the locks, sugar is allowed to enter the cells. Sometimes the locks change in shape. Then the insulin can no longer fit into them. Blood sugar is locked out of the cells. Another reason is when the pancreas can no longer keep up with the demand. Pancreas tries to make up for this by working harder at first. The pancreas keeps up by making more insulin. In time, the pancreas is unable to continue. Either way, blood sugar is locked out of the cells, so It stays in the bloodstream and can become too high, causing hyperglycemia, which can lead to the symptoms of diabetes. When cells cannot get sugar, they no longer have the fuel they need, which is when the symptoms of diabetes may appear as a result of these changes. Some common signs and symptoms of diabetes are urinating often, being thirsty more often than usual, being hungry more often than usual, unusual weight loss, tired more often than usual, blurry vision, wounds that won't heal, numb or tingling hands or feet, frequent infections. You might also get low blood sugar, also called hypoglycemia. Signs and symptoms of low blood sugar can include being hungry, feeling nervous or shaky, sweaty, feeling dizzy, being sleepy, feeling confused. Low blood sugar can happen if you take certain medicines, eat too few carbohydrates, skip or delay a meal, take too much insulin or diabetes pills, are more active than usual. Ask your diabetes care team what your blood sugar levels should be and when you should check it. What is fasting blood glucose and how do you understand blood sugar levels or tests? Fasting blood glucose or postprandial glucose, there are two terms you will hear when testing your blood sugar levels, also known as blood glucose levels. One is fasting blood glucose. Fasting blood glucose is your blood sugar level after you have not eaten for 8 to 12 hours, usually overnight. The second term is postprandial glucose. This is your blood sugar level taken 1 to 2 hours after you have eaten. What is an A1C test? The A1C test measures your A1C average blood sugar level over the past 2 to 3 months. It's like a memory of your blood sugar levels. It shows you how well you're controlling your blood sugar levels over time. Your A1C and your blood sugar levels go up and down together. Lowering your A1C to below 7% reduces your risk of problems from diabetes. Therefore, the A1C goal for most people is less than 7%. It is recommended that you get an A1C test at least 2 times a year if your blood sugar is under control. 4 times a year, or about every 3 months if you are not meeting your goals. I hope that you liked the video and got useful information from it. It takes hundreds of hours of research to make these videos. Please share this video with someone who can benefit from it. Please like and subscribe so you can get new information about diabetes. See you in the next video.